Nursing students, are you prepping for NCLEX? Here are 20 high-yield NCLEX questions you must know. Let's start with question number 1. A patient is in sinus bradycardia with a heart rate of 45 beats per minute. The blood pressure is 82/60 and the patient reports dizziness. Which intervention should the nurse anticipate? A. Administer digoxin. B. Prepare for defibrillation. C. Continue cardiac monitoring. Or D. Prepare for transcutaneous spacing. Okay, the correct answer is letter D, prepare for transcutaneous spacing, and this is the rationale. The patient has symptomatic bradycardia with signs of perfusion, and this includes hypotension and dizziness. When bradycardia causes instability, the nurse should anticipate interventions to improve heart rate and perfusion, including transcutaneous spacing. Question number 2. A nurse is preparing a patient's skin before collecting a blood culture specimen. Why is pivadone iodine or betadine applied to the collection site? A. It softens the skin before the venipuncture. Letter B. It prevents the skin from drying. Letter C. It reduces skin microorganisms that could contaminate the specimen. Or letter D. It cools the skin to decrease puncture discomfort. Let's look at the correct answer. It's going to be letter C. It reduces skin microorganisms that could contaminate the specimen. So this is the rationale. Betadine is an antiseptic medication. It decreases microorganisms on the skin, which helps prevent contamination of the blood culture specimen. Let's go to our next question. A patient with glaucoma is prescribed a medication that promotes diuresis and decreases the production of aqueous humor. Which medication should the nurse anticipate? Is it going to be letter A, chlorothiazide, letter B, acetazolamide, letter C, benzoplumethiazide, or letter D, dimethylcarium bromide? Okay, so correct answer is letter B, acetazolamide or Diamox. This is the rationale. Diamox is a carbonic anhydrase inhibitor. It reduces aqueous humor production and may be used to lower intraocular pressure in patients with glaucoma. Let's go to the next question. A patient reports fatigue and shortness of breath and appears pale. After reviewing the patient's medication list, which medication should concern the nurse most? A. Famotidine, B. Methyldopa, C. Ferrous sulfate, or D. levothyroxine? Okay, so let's look at the correct answer. It's going to be letter B, Methyldopa or Aldomet. That's the brand name. This is the rationale. Methyldopa or Aldomet can cause hemolytic anemia. Fatigue, dyspnea, and pallor may indicate anemia, so this medication requires follow-up. Let's look at question number 5. Which medication requires the nurse to monitor patient for hyperkalemia? Letter A, furosemide. Letter B, metolazone. Letter C is spironolactone. Or letter D, hydrochlorothiazide. Okay, the correct answer is letter C, spironolactone, which is aldactone. So this is the rationale. A spironolactone or aldactone is a potassium-sparing diuretic. Because it helps the body retain potassium, the nurse should monitor for hyperkalemia. So if you're new to this channel, please like, follow, and subscribe as I'm growing this channel to help nursing students prepare for their NCLEX. Question number 6. A patient is scheduled for a contrast CT scan of the spleen. Which question should the nurse ask first before the procedure? Letter A. Do you have a sensitivity to iodine or contrast media? Letter B. Have you received blood transfusions in the past? Letter C. Do you have fear of small or enclosed spaces? Letter D. Do you have any internal metal implants? Okay, so let's look at the correct answer. It's going to be letter A. Do you have sensitivity to iodine or contrast media or contrast dye? This is the rationale. Contrast dye may contain iodine-based agents. The nurse should assess for iodine or contrast sensitivity before the scan to reduce the risk of allergic type of reaction. Okay, so let's go to question number 7. A nurse is teaching a patient about what to expect during a bone marrow examination. Which statement should the nurse include? Letter A. You will receive general anesthesia because the procedure is very painful. Letter B. You should not feel any discomfort once the site is numbed. Letter C. You may feel brief, sharp pain when the marrow is aspirated. Or letter D, you should feel no pain during the test, but aching may last several days. Okay, the correct answer is going to be letter C. You may feel brief, sharp pain when the marrow is aspirated. So this is the rationale. Local anesthesia numbs the skin and tissue, but patient may still feel pressure and brief sharp pain during the bone marrow aspiration. Okay, so let's go to question number 8. A lymph node biopsy is most commonly performed to evaluate which finding? A. Leukemia. B. Cause of lymphedema. Letter C, bleeding tendencies. Or letter D, malignant cells in the lymph tissues. Okay, so the correct answer is letter D, malignant cells in lymph tissue. This is the rationale. A lymph node biopsy is often used to determine whether abnormal or malignant cells are present in the lymph nodes. Let's go to question number 9. A patient's laboratory results show a major decrease in red blood cells, white blood cells, and platelets. Which term should the nurse use when reporting this finding? Letter A, hemolysis. Letter B, leukopenia. Letter C, pancytopenia. Or letter D, thrombocytosis. So the correct answer for question number 9 is, let's look at it together. Letter C, pancytopenia. The rationale. Pancytopenia means all 3 major blood cell lines are decreased, and these are red blood cells, white blood cells, and platelet. Let's go to question number 10. Molecular cytogenic testing and gene analysis may help diagnose, stage, and guide treatment for hematologic disorders. Which sites are appropriate for obtaining the specimen? Select all that apply. Okay, so letter A, skin sample. Letter B, lymph node. Letter C, bone marrow. Letter D, arterial blood. Or letter E, inner cheek mucosa. Okay, so what was your answer? Okay, the correct answer is going to be B and C, lymph nodes and bone marrow. This is the rationale. For hematologic disorders, specimens are commonly obtained from affected blood-forming or lymphatic tissues, such as the bone marrow or the lymph nodes. So again, if you're new to this channel, please like and follow and subscribe. Let's hit 1,000 followers here. And I will make more videos like this and more NCLEX-style videos. Question number 11. A patient with progressive or passive-aggressive personality traits is being seen at a mental health clinic. Which behavior is commonly associated with this disorder? Letter A, elevated intellectual ability. Letter B, hidden resentment or hostility. Letter C, strong dependence on others. Or letter D, open expressions of feelings. Okay, correct answer is letter B, hidden resentment or hostility, which is the rational. Passive-aggressive behavior often involves indirect expression of anger, such as procrastination, sarcasm, stubbornness, or subtle resistance. Let's go to question number 12. A patient is admitted for evaluation of aggressive behavior and is diagnosed with antisocial personality disorder. Which nursing approach is most important? Letter A, establish clear and consistent limits. Letter B, encourage the patient to express guilt for past behavior. Letter C, limit all interactions with other patients. Or letter D, encourage the patient to act out angry feelings. Okay, what do you think is the answer? If you selected letter A, you got it right. Establish clear and consistent limits. This is the reason for this correct answer. Patients with antisocial personality may test rules, manipulate others, or disregard boundaries. Clear limits help maintain safety and structure. Let's go to question number 13. A nurse is monitoring a patient with bulimia nervosa for treatment adherence. Which intervention is most appropriate? Letter A, allow the patient to eat meals privately. Letter B, praise the patient for finishing all meals. Letter C, observe the patient for 1 to 2 hours after meals. Or letter D, encourage the patient to select preferred foods and eat in moderation. Okay, so let's look at the answer. Letter C is the correct answer. Observe the patient for 1 to 2 hours after meals. So let's look at the rationale. Patients with bulimia nervosa may purge after eating. Observation after meals helps prevent vomiting, laxative use, or other contemporary behaviors. Let's go to question number 14. Assuming normal growth and development, which child has the greatest risk of accidental poisoning? Letter A, a 6-month-old infant. Letter B, a 4-year-old child. Letter C, a 12-year-old child. Or letter D, a 13-year-old child. Okay, correct answer is letter A, a 4-year-old child. This is the rationale. Preschool children are curious, mobile, and likely to explore by touching or tasting objects. This places them at a higher risk for accidental poisoning. Let's go to question number 15. Which example best describes parallel play? Letter A. Jenny and Tommy share toys while playing together. B. Jimmy plays with his toy car beside Miss Mary, who is playing with her doll. C. Kevin plays a board game with Cathy and Sue. Or letter D. Mary plays a handheld game while sitting on her mother's lap. Okay, correct answer, y'all, is letter B. Jimmy plays with his toy car beside Mary, who is playing with her doll. Rational. Parallel play occurs when children play near each other but do not actively play with each other. This is very common in toddlers. 16. An older adult patient has a new diagnosis of type 2 diabetes. The patient reports difficulty following the meal plan and remembering prescribed medications. Which nursing actions support treatment adherence? And this is a select all that apply. So letter A, request dietitian support for meal planning. Letter B, involve the patient's support system. Letter C, assess the patient's cognitive behavior. Letter D, encourage use of daily medication organizer. Or letter E, provide written teaching materials for home use. So this is a select all that apply. Okay, we have multiple answers here. A, B, C, D, E. Everything, right? The patient is having difficulty with both diet and medication routines. The nurse should use several supports: dietary referral, family or caregiver involvement, cognitive assessment, medication reminders, and written materials. Our next question, question number 17. A nurse is using the illness-wellness continuum to evaluate patients. Which patient is closest to the center of the continuum? Letter A, a college student with influenza. Letter B, an older adult newly diagnosed with type 2 diabetes. Letter C, a new mother with urinary tract infection. Or letter D, a young adult with long history of well-controlled rheumatoid arthritis. Let's look at the answer. The correct answer is going to be letter D. A young adult with a long history of well-controlled rheumatoid arthritis, and this is the rational. The center of the illness-wellness continuum reflects a more stable health state. A patient with a chronic condition that is well-controlled is closer to the middle than a patient with an acute illness or new diagnosis. Our next question, question number 18. A nurse is teaching patients at a health fair about factors that can affect health and wellness. Which factors are modifiable? Again, this is a select all that apply. Letter A, smoking socially. Letter B, BMI of 28. Letter C is alopecia. Letter D is trisomy 21. Or letter E, history of reflux. Correct answers are letters A, B, and E. These are the rational. Multiple modifiable factors or health-related factors of a patient that can potentially change their behavior, treatment, or lifestyle adjustments. Question 19. A patient recently diagnosed with breast cancer is discussing the diagnosis with the nurse. Which statement suggests the patient may not fully understand the illness? Letter A, I do not have family history of breast cancer. Letter B, I need a second opinion, there's no lump. Letter C, I am glad we live near several large hospitals. Letter D, I will schedule surgery next week even though it is during the holiday. The correct answer is letter B, I need a second opinion, there is no lump. Requesting a second opinion is appropriate. However, saying there is no lump suggests the patient may not understand breast cancer can be detected through imaging or biopsy even when no lump is felt. Our last question number 20. A patient is admitted with episodic severe headaches, sweating, palpitations, and blood pressures of 210 over 118. The nurse suspects pheochromocytoma. Which medication should the nurse anticipate before surgical removal of the tumor? Letter A, propranolol. Letter B, penoxybenzoamine. Letter C, hydrochlorothiazide. Or letter D, dopamine. So the correct answer is letter B, penoxybenzoamine. So pheochromocytoma is a catecholamine-related problems which secretes catecholamines in the adrenal tumor that can cause severe hypertension, headache, sweating, and palpitations. The priority medication is an alpha blocker such as penoxybenzoamine to control blood pressure before surgery. If you're able to like, follow, and share this video with your classmates, that would be better. Thank you for watching.